Hi, thanks for joining me today as I discuss disease prevention and biosecurity for rabbits going to and from shows. My name is Dr. Melissa Justice, and I'm a field veterinarian with the Indiana State Board of Animal Health. I'm also the Director of Small Animal Health Programs for the agency. Today we're going to discuss ways that you can prevent the spread of disease to your animals. We will discuss disease awareness, which means understanding the common infections or illnesses that can affect your rabbits and having an idea what they may look like in your animals. We'll talk about disease prevention, specifically biosecurity, cleaning and disinfection, and daily observation of your animals. This is really important so that you know how your animals act when they're feeling good and can quickly identify when something's wrong. There's no way to assure that all animals at shows are free of disease or infection, even with the most thorough observation or examinations. If exhibitors are careful, they can take measures each and every day to prevent the spread of disease or infection to their own animals. So just remember to take simple steps each and every day to keep the germs away from your rabbits. Shows could be a huge point of infection for your rabbits. This is because animals will have increased exposure to diseases while they're commingling at a show. And depending on the size of the show, animals may be exposed to hundreds of animals that they wouldn't normally be around in their day-to-day lives. They may also be exposed to a different group of animals each weekend if they're moving from show to show. Stress is another factor associated with increased disease transmission. Going to a show and being around people the rabbits aren't familiar with can cause physical stress in their bodies. This environmental stress can increase the severity of clinical signs in an animal. A rabbit could have a very mild infection before heading out to a show and have no clinical signs associated with their illness. When they experience stress on their bodies, it can allow the worsening of clinical signs, and they could become clinically ill in a short amount of time. Stress also plays an important role in the amount of pathogen that is shed by an animal in their bodily fluids, such as urine, feces, and respiratory secretions. By increasing the amount of pathogen being spread into the environment, you have a much greater chance of disease being spread to other animals. So let's start by talking about things that you can do to prevent the spread of infection. Whenever you take an animal to a show or exhibition, we recommend that you take extra precautions to protect your animals. You should avoid touching rabbits that do not belong to you. Some diseases, like rabbit viral hemorrhagic disease or RHDV2, are extremely contagious, so just touching or petting another animal could result in infection in your rabbits. Make sure to take all of your own show supplies from home. Don't share grooming equipment, bedding, food, hay, water, or any other supplies with other exhibitors because this can transmit diseases. Make every attempt to ensure that there's appropriate space between your cages and those belonging to other exhibitors. Depending on the size of the facility, the show organizers may have several cages in a small area, so in these instances, consider placing a non-permeable barrier between your rabbit cages and others located nearby. Make sure to check with the show organizers first to be certain that this is allowed. Try to be aware of disease spread, which can occur by touching common surfaces. Consider disinfecting common surfaces before allowing your animals to have contact with them. Many show organizers are now cleaning and disinfecting show tables and boxes since RHDV2 was diagnosed in the US last year. Be sure to wash or sanitize your hands frequently, especially after contact with shared equipment or surfaces. So think about places like restrooms, gates, concession stands, door handles, things like that. It's important to realize that hand sanitizer is not considered to be an effective means of disinfection for RHDV2 or rabbit hemorrhagic disease virus, so try to wash your hands whenever possible. Make sure to arrive at the show wearing clean clothing so that you don't accidentally bring something from your colony into the show. Also make sure that you change your clothing before you handle your rabbits or supplies at home. Make sure that you sanitize your footwear before going into the show and before going home. For the prevention of RHDV2, you might consider having a no outdoor shoe policy in your home or in the building where you keep your rabbits. Because this disease can affect wild rabbits and it's so highly contagious, it can easily be spread on your clothing or your shoes. So we've talked about bringing infections home from a show on your equipment or your clothing. Another important source of infection for a group of rabbits is the addition of new animals. These animals can introduce infections or diseases that your rabbits may have never been exposed to before. So it's very important to consider the source of a rabbit when you're making an addition to your colony. Don't just look at the price of the rabbit or the genetics that it may have. Consider the biosecurity, husbandry, and disease status of the colony that you're getting the animal from. Ask yourself these questions. Are they monitoring for diseases on a regular basis? Are the animals raised indoors or outdoors? If you're buying animals from an RHDV affected state, so down in the southwestern United States or in Florida, or if the breeder has purchased animals from an affected state recently, make sure that you determine the vaccine status of the animals and quarantine all new additions to your colony. Another way to keep your rabbits healthy is to practice good biosecurity measures at home. Biosecurity is the methods that you use to stop a disease or infection from spreading from one person, animal, or place to another. Excellent biosecurity can prevent disease and parasite transmission to your animals. So now let's talk about specific things that you can do to increase your level of biosecurity. We'll start by talking about quarantining of animals. This is a strict isolation period which is imposed on an animal to prevent the spread of disease. All new additions, as well as animals that are returning from shows or exhibitions, should be quarantined when they're being brought back to your property. We recommend a minimum quarantine period of 30 days, but suggest that you consider a quarantine period of 60 days if you're trying to prevent RHGV2. The place where you quarantine your rabbits should be a separate physical location away from the rest of your rabbits. And if possible, we recommend that quarantined animals be kept in a different building or room away from the rest of your rabbits. Keeping quarantined animals in the same room as the rest of your animals is a huge risk, so it pays to set up a separate location. Quarantined animals should not have contact with the other animals during their quarantine period. It's also important to have equipment and supplies that are only used in the quarantine area so that diseases aren't moved from room to room. Make sure to wash or sanitize your hands before and after caring for the animals in the quarantine area. This will help to prevent the spread of disease between both groups of animals. You should always, always, always care for the rabbits in the quarantine area last, after you've finished taking care of all of your other rabbits. You might even consider keeping a separate change of clothing and shoes, which are to be used only when in the quarantine area. This can help prevent the spread of disease on your clothing and your shoes. You could use a pair of coveralls and slip-on boots when working in this area, just something to cover up your normal clothing that you're going to wear back out to your colony. When you move rabbits out of this area, make sure that you clean and sanitize all of the cages, equipment, and clothing that have been used in this area before using it anywhere else and before moving new rabbits into this area. Next, I want to talk just briefly about cleaning and disinfection. We recommend that you get into the habit of removing the manure from inside the cage and below the cage on a pretty regular basis. Pathogens can live in the fecal material and cause the spread of disease. Feces also attracts insects, which can be a contributing factor for the spread of some diseases, specifically RHDV2. In order to effectively clean and disinfect a surface, you must remove all organic material from the area first. This includes bedding, hair, hay, feces, and urine. You cannot disinfect dirt, so you have to make sure and get it out first before you do your thorough cleaning and your disinfection. When choosing a disinfectant for your facility, you want to make sure that you use a product that's effective against the diseases that you're concerned about. So you need to look at the product label and work with your veterinarian to determine what product is going to be best for you. You want to make sure that you thoroughly clean each surface using soap, water, and a brush prior to disinfection. Then you want to disinfect all of the items in your facility on a pretty regular basis. When you apply the disinfectant, you need to make sure that you allow for the appropriate contact time with the surface that you're cleaning. And what this means is that disinfectant has to remain in contact with that surface for a specified amount of time in order to thoroughly neutralize the disease that you're trying to eliminate. Each product has the contact time listed on the label, and it's generally going to be between 5 and 10 minutes. After you've met the appropriate contact time, you want to make sure that you thoroughly rinse the surface with water to avoid rust and corrosion. I want to finish up the discussion today by talking about observation and disease awareness. By checking in on your animals each day, you can begin to learn what's normal for each and every one of them, and this can be different for each different rabbit. You want to pay attention to their breathing patterns. Is it fast or slow? Do they seem to be working harder to breathe than normal? You might notice how much food and water they drink each day. If you notice that they haven't eaten for their food for 24 hours, this could be an indication that they need to be seen by your veterinarian. Get to know what's a normal behavior for them. Are they lazy and just hang out all day, or are they extremely energetic and run around? Look at the consistency of their stool. Is it normally well-formed, firm pellets, or is it normally a little bit more soft? Also pay attention to the quality of their hair coat. By picking up on subtle changes early, it can help you to treat illness and infection much more effectively. I reached out to a local exotic veterinarian and asked what diseases they commonly see both during and after the show season. So I want to talk just briefly about some of those diseases and what they may look like in your animals. What I think is most important to understand is that many diseases may cause only mild illness or no clinical signs at all under normal day-to-day circumstances. And it's not until we place the rabbits under stress that we can increase disease transmission and the severity of clinical signs in our rabbits. So the diseases of concern that I want to talk about just briefly are rabbit hemorrhagic disease virus, rHDV2, Pasteurellosis, Coccidia, or E. cuniculi. And it's important to know that these aren't the only diseases that are out there. These are just some of the most commonly seen diseases. We'll start with rabbit hemorrhagic disease virus, or rHDV2. This disease is common in many other countries in the world, but it's considered to be a foreign animal disease here in the United States. Last summer, there was an outbreak of disease in 7 southwestern U.S. states, as well as Mexico, which caused great concern in the rabbit industry and affected the way that rabbits were shown. It's important to understand that this disease has not been diagnosed here in the state of Indiana, but it remains consistent out in the southwestern U.S. and Mexico, so we have to remain vigilant here in Indiana to keep this disease out of our state. The clinical signs of rHDV2 can vary. Some animals may show acute collapse or sudden death with bleeding from the nose, mouth, or rectum, while other animals may exhibit less severe clinical signs, so things like a loss of appetite, lethargic behavior, or a high fever, which could result in spasms, shaking, or seizures. It's important to realize, though, that some rabbits can be completely asymptomatic, showing no clinical signs at all, but they still can transmit the virus to other animals. Exposure to the virus does not necessarily mean that a rabbit's infected with the virus. Some rabbits will just be exposed and never progress to the infected state, while others will be exposed and become infected. Then they either die as a result of that infection or they recover. There are various different forms of transmission, but what's so important for you to remember with rHDV2 is that it is extremely contagious. Transmission can occur through contact with infected rabbits, either live or dead, contact with secretions and excretions, so this is the saliva, ocular and nasal discharge, urine or feces, or contact with rabbit products, so fur, wool, and fresh or frozen meat. And it's important to realize that this not only affects domestic rabbits that we're raising and owning and breeding, it also can affect wild rabbits that are living out in the environment. Transmission can occur through contact with inanimate objects that have been contaminated by the virus, and we call these things fomites. So as we've discussed previously, your clothing and shoes, dishes and water bottles, cages and carriers. It can also occur through contaminated feed, grass, or hay, so it's important to know where you're purchasing these items from and make sure that you're not getting them from an affected state. Can also occur through contaminated bedding. Finally, RHTV2 can be spread by insects, scavengers, birds, or rodents. These things aren't necessarily infected with the disease, but they can move them mechanically from one location to another. It's also important to realize that if a carnivore eats the carcass of a dead rabbit, the virus can pass through the animal and still be viable and infective in the feces. Humans can transport the virus by touching an infected rabbit or surface and then touching other rabbits, such as at fairs, exhibitions, and within a colony. So this is why we talked about biosecurity and disease transmission at the beginning of this presentation. The next disease that we'll talk about is Pasteurellosis, or snuffles. This disease is caused by a bacteria called Pasteurella maltacida. Most rabbits have been exposed to this bacteria at some point in their life, and they may or may not have exhibited clinical signs. Whether or not they show clinical signs depends on how good their immune system is and the severity of the bacterial strain that they're infected with. So not all infected rabbits will actually show clinical signs. The important thing to realize, and what we talked about earlier, is that stress can contribute to the onset of clinical illness and the severity of clinical signs, as well as increase the transmission from one rabbit to another. Clinical signs of snuffles usually depend on a couple of different factors: where the bacteria is in the body and how competent the animal's immune system is. A lot of times we'll see respiratory signs. So the animal is sneezing, may see nasal discharge, which usually starts out as being clear, but can then progress to being mucoid or purulent in nature. Sometimes we'll notice matted fur on the front legs due to this increased amount of discharge and then the process of trying to groom themselves. We may notice nasal congestion or labored breathing, and it can progress to pneumonia in these animals. We can also notice signs in the eyes with conjunctivitis, so an increase in the color of the tissue surrounding their eyes, so they usually get an increased pink color or redness, and they can become swollen. We can see ocular discharge, so clear discharge running from the eyes, or even a green-yellow colored discharge from the eyes. If it's severe enough, we may start to notice hair loss or irritation around the eyes as well. If the bacteria is either introduced into other areas of the body or spreads to other areas of the body, we can see different clinical signs. So things like abscesses in the skin, we can see sinus infections or ear infections, discharge from the reproductive tract, or CNS signs such as a head tilt or nystagmus. And nystagmus is when the eyes move rapidly back and forth from side to side. We may also see less descriptive clinical signs like depression, poor appetite, or weight loss. And if one of the legs is affected, either at a joint level or through an abscess, we can see lameness or pain when moving. Transmission occurs through direct contact with infected materials or animals, so through respiratory secretions, the act of mating, or we can see abscesses spread secondary to bite wounds. So the risk factors for infection are immunosuppression through environmental stress or concurrent disease, the age of the animal, if they have an immature or weak immune system, like we might see in extremely young or old animals, or if the animals have poor husbandry or care. The next disease that we'll talk about is coccidiosis, and this is primarily a gastrointestinal or GI disease of rabbits. This disease is caused by a microscopic parasite that lives in the rabbit's intestines or in the liver. The organism is species specific, so it only affects rabbits, doesn't affect other animals or humans, and transmission occurs through the direct ingestion of infected feces from another rabbit. The severity of the infection, like many of the others that we've talked about today, depends on the species of Eimeria that the animal is infected with, the immune system of the rabbit, the age, and the environmental stressors. So it's important to realize that many infected rabbits may never show clinical signs of illness, and it wouldn't be something that you would pick up on unless you took a fecal sample into your veterinarian for a diagnostic test. If they do show clinical signs, they can really vary. You may notice watery mucoid or blood-tinged diarrhea, lethargic behavior, weakness, poor appetite, weight loss, depression, or dehydration. Sounds very similar to some of the other diseases that we've talked about today. The last disease we'll talk about today is E. cuniculi. E. cuniculi is a tiny fungal organism that lives inside of the rabbit's body and can be a significant source of illness for these animals. Studies have shown that a high number of rabbits here in the United States have been infected at some time in their life, with estimates ranging anywhere between 40 and 80% of all house rabbits. Once the organism has entered the rabbit's body through ingestion, it's carried in the bloodstream to organs such as the liver, kidneys, or central nervous system, where it may cause clinical signs of illness. Only about 6% of infected rabbits will ever show clinical signs of disease. The majority of infected rabbits show no clinical signs at all. Immunocompromised animals or those under stress are more likely to show clinical signs of illness. In healthy rabbits, these spores become dormant in the brain or the muscle tissue and can be present with no clinical signs for years, and it's not until they are put under a period of stress or their immune system begins to fail that they may show those clinical signs of disease. This infection can be zoonotic, with immunocompromised humans being at a greater risk for opportunistic infection and disease. So as I just mentioned, the clinical signs that we typically see with E. cuniculi infection, if they're noted at all, are associated with the central nervous system, the eyes, or the kidneys. So what we may notice with the CNS sign is head tilt, rear limb paralysis, tremors, or seizures. And often what we'll see is just a sudden onset of weakness in the rear legs or complete paralysis in the rear legs. And oftentimes the owners are concerned that these animals may have injured or broken their back. Cataracts can result in a change in the rabbit's ability to see and may have a cloudy appearance to the eyes. And kidney disease could cause clinical signs of increased thirst or increased urination. Transmission of E. cuniculi occurs either through inhalation or ingestion of the spores, which are shed in the urine of an infected rabbit. As I mentioned previously, some animals can experience reactivation of the dormant organisms after experiencing a period of stress. So you can have a rabbit who's shown no clinical sign, has been perfectly healthy, living with a group of rabbits for many, many years, and all of a sudden it becomes clinically ill after a stressor. The severity of the infection really is going to depend on the number of organisms that the animal was exposed to and the immune response of the affected animal. So today we've talked about 4 very different illnesses that can have very similar clinical signs. Honestly, it can all seem somewhat overwhelming. So what can you do? Remember to monitor your animals daily for signs of illness, learning what's normal and abnormal for each of them. Noticing clinical signs of illness early and starting appropriate treatment can make the difference between healing the animal and potentially losing the animal. Also, make sure to establish a working relationship with your veterinarian. They can assist you when your animals are showing clinical signs and provide appropriate care and treatment for the animal. They can also review your biosecurity and recommend areas for improvement. Just remember to take simple steps each and every day to prevent illness in your animals. If you have any additional questions or concerns, please feel free to send me an email at mjustice@boah.in.gov. You can also give me a call through our central office number, which is 317-544-2400, or feel free to check out our website where we've got some additional resources about some of the things we talked about today and other videos on biosecurity and RHDV2. Thanks for joining me and have a great day.